This 9-week series that I'm doing, tonight is the fourth one. It's just to lift up some pregnancy awareness tips, some ideas, centering home birth in this platform because I am a home birth midwife. Thank you for the hearts. That's a cute t-shirt. Thank you. They giving them away. They're going to be giving them these shirts, the updated version. This one is kind of old and dated. As I said, it's faded, but I love it dearly. But they'll be giving away swag bags, t-shirts, all kind of stuff. Just come out on Saturday the 16th, 10 to 2, the West End. Check it out on Eventbrite. It's going to be at the Mother House over there off of Ralph David Avenue. So you are more than welcome to come and join the fun. So tonight I'm going to chat with y'all about optimizing a vaginal delivery, right? Hey now. So if you know a pregnant woman, pregnant person, tag them, pull them into the chat, because I'm going to kind of dive in on how to optimize getting this baby out of your body through your yoni, right? And not cut as a C-section. So it's definitely going to be helpful if you're trying to have a VBAC, if you're your first time mom, or even if not, maybe you had an epidural or something else happened in the other previous pregnancies, and you want to achieve an all-natural, unmedicated birth. This information is good for everyone, because sometimes you might have a vaginal and then end up with a C-section based on the position of this baby. It does make a huge difference on how this baby fits into your pelvis and out of your body, right? So swag bag, food, t-shirts, the Mother House. Yes. Thank you for lifting that up in the chat for me. Thank you so much. I'll probably be wearing my glasses on and off tonight, y'all, because I realize I see better with them, right? That's what we're supposed to do anyway. Thank you. I see better with my glasses. I have to start wearing them. It's one of those things where, like my mom told me, you live long enough, age will find you. And so age has found my eyes. And now I'm finding myself needing to wear my glasses more frequently. But it's all love. I give thanks for sight. Thank you. I tried to be a little cute, try to do a little something to make them, stand out. Indeed. Okay. So we're going to let's chat a little bit about this beautiful body part called the pelvis, right? The pelvis. Now, women have a variety of different pelvises. I wouldn't just say women. I think people, period. We all have a variety of different pelvises just based on your genotype, right? Your anthropology teaches us about 4 basic pelvises, but I'm going to highlight one in particular that most Black women have, and that's called an anthropoid pelvis. Now, an anthropoid pelvis basically just means, to simply put, that you have hips, right? So the reason why, when you look up an anthropoid pelvis, you're going to find that the pelvis, the hips at the top, the hip bones, they flare out more than they do in, like, say, a gynecoid pelvis, for example. Those are more narrow shaped hips. And some of us have those too, but I want to center an anthropoid pelvis because, again, it's more common with Black women. And so anthropoid pelvis is meaning you have hips. A lot of times when you have an anthropoid pelvis, your baby will hang out either on the right side or the left side. Very rarely will our babies just align perfectly at the front, right? So even in this model, though the baby there is intended to be abstract, right? There's a baby there, but it's more abstract. You still kind of see that this baby, you get an instant visual that this baby is head down and facing mom's back, right? That's right. We're going to drop some gems tonight. You better say it. So, yes, anthropoid pelvis, right? And so our babies won't necessarily be straight looking back at our backs. A lot of times, like I said, they'll be either on the left or they'll be on the right. And that's because we have these hips that kind of flare out. Now, many cases, you'll find that your baby or our babies tend to hang out on the right side, especially if you're right-handed, right? And the reason for this is babies like to go to where there's more space. It's not because babies like it per se, on the right is because they tend to have more space on the right if you're right-handed. And the reason for that is if you're right-handed, you tend to lean to the left. You lean a lot to the left. You probably carry your purse on the left. You're carrying groceries. You're carrying bags. If you're standing and you're working, you're leaning to the left. And all of that leaning to the left constricts and narrows the space on the left side of your body. And you can talk to a chiropractor about this. I definitely lift up chiropractors. They are excellent for helping to adjust hips and optimize birthing space for babies. And we're going to talk about that in a little bit more detail. But ultimately, babies go to where there is the most space, right? And in most cases, like I said, if you're right-handed, that's going to be on the right side of your body. And so the reason why it's important to identify that is because an optimal birthing position for your baby actually is on the left side. It's actually on the left side, not the right. And the reason for this is babies make what's called cardinal movements on their descent downward and out of your body. They literally move clockwise. During labor, they're slowly turning, unless they're inhibited by, say, your cord or the placenta or another baby that's in there with them. In most situations, your baby is going to rotate themselves clockwise, not counter. I'm looking at myself in reverse and over to the left. And so if your baby starts out on the right side at the beginning of your labor, then the chances are very high that your baby could potentially rotate themselves during labor face up. Now, if you ever heard of sunny side up, right? Sunny side up just means that your baby is in your pelvis just like this. Now, I always say that we can argue pain in labor, right? There are all kinds of, I just love the hearts. There are all kinds of childbirth education series out there that will argue and debate pain in labor and say, let's not call it pain. It's actually just pressure. Or let's not call them contractions, they're pressure waves. And just yesterday, one of my clients told me, we're not going to call it a ring of fire. It's a ring of pleasure. It's cute. I love it. I honor it. Whatever gets you through that birth, right? But I will also say that when your baby is face up, and I speak from experience, being a mother of 4, and my 4th child was just like this. And it hurts. It hurt. I had a home birth with her, and I knew that pain was hitting differently. And unfortunately, the midwife that I had at the time did not identify that my baby was face up until she was born. And so I had excruciating back labor the entire labor. And that's actually what it looks like, right? Play on words, right? That's actually a painful birth, right? Because now you have the hardest part of the baby's body, which is the back of the head and the baby's back, applying all this pressure on the nerves that you have here going down your lower spinal column in your tailbone area. You have a gang of nerves down here. And so when the baby is applying all that pressure from the back of their heads onto that, every time you have a contraction, it's squeezing and it's applying pressure to the back, your tailbone here, that hurts. It hurts. It hurts. I'm going to tell you. And I feel so sorry for moms when I see them because I can empathize, like I said, because that was me 16 years ago. She's a big girl now. But anywho, ideally, you want your baby to be on the left, right? We really do. It's great when we can start out our labor with the baby on the left. If your baby starts out on the right, like we said it earlier, the chances are very strong that your baby could rotate around to your back and be sunny side up and get stuck there. So if your baby starts out here, because as they're rotating, remember, and I'm not going to tell you the word because for all of those that was listening, I hope you remember the word of those movements, the clockwise movements your baby makes on their descent out. I'll be wrapping off a book momentarily, right? But nonetheless, when your baby starts out here, if they're slowly dropping, and forgive my blue-eyed baby, right? From another life. Anyway, babies slowly dropping, they can get stuck here. They can get stuck. And I will honestly say, it is my serious belief that breech babies come out easier than sunny side up or OP is another term we use for that, which basically, I'm not even gonna go into that. But OP babies are babies that are face up, because now this baby is trying to fit through your pelvis with the widest diameter of their head. So when babies, and my little baby has a little something going on, but what we want you to give attention to is the soft spot. These soft spots were, intentionally designed so that babies can fit through, and these soft spots can kind of overlap or mold themselves. You ever seen a baby come out and they have a narrow head, right? That cone-shaped head? That baby had to squeeze and mold its head to fit through the vaginal canal. They can't do that when they're face up. Those bones don't squeeze. They don't receive pressure in the same way when they're coming through face up in this manner. So like I said, they're coming through with the widest diameter of the head, and sometimes they just don't fit, unfortunately. And then these situations, unfortunately, end up in many cases in C-sections because babies get stuck and they can't fit through. So, chiropractor, right? I know you want to know how to avoid it. Chiropractors are excellent. Yes, I've seen babies come out with the cone-shaped heads. That's one of the reasons why they will come out that way. Another reason is mom's just stalling out on her pushing phase. I think I see that more than anything in home birth scenarios. All of these moms watching these videos, and they get to the point of pushing. They start visualizing these videos, and for whatever reason, they freak out and they don't want to push. And so I'm not going to force you. I'm just going to wait. As long as my baby looks good and you got the stamina for it, hey, let's just rock out. Wait till you feel like you're ready to push your baby out. And then that can cause a cone-shaped head as well. But in some cases, like I mentioned, if it's a tight fit, right? Say this mom was an athlete or a dancer. And I'm going to speak to that as I chime in about chiropractic care in pregnancy, right? Athletes and dancers have very tight muscles, especially if they were an athlete or a dancer during their formative years, anywhere from, I'll say, elementary on through high school. If this child, and I know, ladies, we love our girls to be out there because I did it. My girls were in dance, and I had one that was an athlete. She played tennis, but it was really before I knew the impact it had on the pelvis, specifically ballet. And I'm so grateful I steered away from ballet. My girls didn't take to it. Ballet literally torts the pelvis. It torts it. And many ballet dancers have to have C-sections because the act of how they have to position their feet in that way for hours on end, days after days, practice after practice, it torts the pelvis inward. And it makes it very difficult. In birth, this tailbone has to lift up. It lifts up, they say, as much as 25% during birth, right? It lifts up and out the way so the head can fit. Right? Somebody said, ugh, I was a ballerina. My pelvis is so tiny. Bless your heart. Beautiful. Chiropractor. I cannot stress it enough. And possibly even seek out a patient home birth midwife, right? I had one of my longest births, bless her heart. Oh my goodness. This mama, she was an athlete, track runner, and all the things. And she was also, I think, a personal trainer by the time we started working together. Young 20s. But she had the longest, hardest birth. Like, she dilated pretty quickly. But that pushing phase, it was such a tight fit because the baby had to really force that pelvis open. And this is really the birth that taught me the importance of chiropractic care in pregnancy. And so now if I have a mom that I know was a dancer or an athlete, I highly recommend they go to the chiropractor because they do what's called a Webster technique. And with that technique, they tend to align the pelvis in such a way that helps to optimize space for the baby to fit in a better position. And then it also helps to loosen up some of those ligaments and tendons and muscles that will keep all of this tight. All those, we want them tight butts, right? We be doing the squats, we be running, we be doing the lunges, right? We want them tight butts. However, the tight butt muscles apprehend this tailbone from moving out the way. It apprehends, if you can see that, how the pelvis separates. There's cartilage there holding that pelvis together. So the relaxing hormone that kicks in for some women as early as the second trimester, but for many, definitely in the third trimester, that relaxing hormone relaxes all of that. It relaxes the ligaments and tendons and the bone and the muscles so that the bones can move as they need to, right, for that baby to fit through. Also here in the front, your pubic symphysis here, right? That's cartilage. We need that to separate during birth. In some cases, depends on the size of that baby's head. It can make a difference. And the size of your pelvis, right? If you're built kind of small, somebody said they were tiny, you may have a gynecoid pelvis. Those pelvises tend to be a little more narrow, but that doesn't matter. What matters is the inlet. The inlet is what makes the difference and how those babies fit through that inlet. So ideally, like I said, just a brief recap, and then I'm going to raffle off a book. We want that baby to be on the left. So the later you are in pregnancy, specifically when you get to be about 34 weeks or so, 35 weeks, 36 weeks, you really want to identify where your baby is in your body. There's a website, and I hope it's still available. It's been out for quite some time. It's called spinningbabies.com. It is a content-dense website, and you can, they'll help you identify where your baby is based on belly mapping, which we're going to talk about a little bit next. And then once you know where your baby is, you can go on that website and find little tricks and tips about how to move this baby in a better position. I definitely appreciate it, and it's one that I lift up. So, whoop whoop, cardinal movements of birth. Yes, that's when your baby is rotating clockwise on their descent out. All right, so now that we've identified that, let's chat a little bit about belly mapping and how do you do it. Got to get a sip, wet the throat. Okay, so belly mapping is really simple and easy to do. The first thing you want to do, and I'm going to use this image behind me, you kind of want to draw a circle around your belly. Draw a circle around your belly and make sure your navel is centered in the middle when you draw this circle. Okay? She said, I'm excited. Yes. Thank you. So you draw that circle and you make sure your navel is centered in the middle. And then you're going to draw two lines that intersect at your navel, right? And in that space, you've created 4 quadrants, right? At that point, you've created 4 quadrants. And so in those 4 quadrants, you want to then identify, where do you feel your baby's kicks? Where's the kicks? Are they in this upper right quadrant? Are they in the upper left? Maybe you feel it in both, right? Maybe you feel it down in the lower quadrants, right? The lower right or the left quadrant, okay? The reason why that's important, because first and foremost, it'll help you identify whether or not your baby is breech. If you are feeling kicks in these lower quadrants here, anyway, if you're feeling them down here, you're feeling your most vigorous movement, if they're coming down here, or if you're feeling them here, it's a strong possibility that your baby is breech. Okay? And so, again, spinningbabies.com, you want to go on there and understand how to do this a little more. I think they have videos up there. You can also YouTube videos on belly mapping, and they can go more into detail about helping you move this baby. But yeah, if you're feeling those kicks, says belly mapping really helps. Yes, it does. It helps. So even to take it up a notch, you're feeling these kicks. Say you're feeling these kicks in this lower left quadrant, and you're laying back. You take a deep breath. That deep breath is going to relax the uterus. The uterus is a muscle. And then from there, you want to feel. Do you feel something hard on the right side? And then it's squishy and mushy on the left side? If that's the case, this is, we can say with confidence that the baby's on the left and we're feeling the kicks. I'm sorry, the baby's on the right. We feel the kicks on the left, and the baby's most likely in a breech position. Kind of get an idea of where we're going with this. So same for if the baby was head down. We're feeling those kicks in this upper left quadrant or in the upper right. Feel something hard. We could say the baby's here on the left, head down, because I'm feeling these vigorous kicks up here in this right quadrant. So that would be ideally belly mapping. Another one to be very mindful of is if you were feeling those kicks in both of these quadrants here, the upper right and the left. because this would indicate that your baby is sunny side up. She says, yes, thank you, all these gems. Yes, on belly mapping, this would indicate that your baby is sunny side up. And remember, we talked about that just a moment ago. Sunny side up babies typically do not fit through the pelvis. And so one of the first things you can do is get on hands and knees. And I'm actually going to use this baby as a model because I'm not going to get on the floor right now. You want to get, you can visualize my baby on hands and knees, right? You on hands and knees. This is you, not the baby in this moment. Just stick with me. Stick with the visual. You're on hands and knees. Now you're working with gravity. Now you're working with gravity, right? So the baby will tend to move with gravity. Again, remember, the heaviest part of a baby's body is the back and the head. And so if you're on hands and knees, you will help to swing this baby around. You're going to swing this baby around with gravity into a better position. And you can do this. It happens almost instantly. And so if you have a doula, I would encourage your doula to also assist you, or your partner can assist you with this, because you can also do a scarf technique better known as rebozo. I don't like calling it rebozo, y'all, because it is a misappropriation of the term. A rebozo, for any of you that are doulas out there and you're calling it rebozo, please correct yourselves. Rebozo itself has a long legacy in the Mexican culture, and it was misappropriated. It actually has a deep history, or deep her story. So for reference sake, we're just going to call it a scarf technique. And so you want your doula to be able to assist you, or your partner, with just look up rebozo. Because that's how you'll find it. Just like the word doula, it's controversial, that word itself. But anywho, if you look up how to do rebozo on hands and knees, it would be helpful if someone does this on your back. They're basically going to take that scarf and they're going to place it across your back, and then they're going to gently sway it. And that's going to help to loosen your ligaments, especially if we place it across the pelvis in the back, right? The hip bones in the back. And they're kind of moving this in a back and forth motion with both hands across the pelvis. It's going to loosen the fascia that's holding the muscle and things to the bones. And the fascia also, it just kind of works its way in and throughout ligaments and tendons and all of that, and cartilage. And so it's going to help to loosen that fascia when you move it back and forth in that way. And then it's going to create more space or relaxation in those hips for your pelvis to be able to relax. And then for this baby to be able to swing around and move with gravity. Y'all gotta let Mama Sekesa show you the technique talk to you. Yeah. If anybody have a link, right, you can drop the link in the chat. Because I don't have one right offhand that I can send you to, but I know some of these steps can be found on spinningbabies.com, right? And you're looking for a rebozo or scarf technique, where you're using the scarf to help facilitate optimal positions for baby. Another way that they can do it is actually placing this across your pelvis. Your belly, your abdomen. So that you would place it here, and then you go onto hands and knees. And then the person behind you is pulling it, right? And they're kind of working it like this. And when they jerk it from side to side, that, along with gravity, helps to loosen baby. It helps to move baby. Baby kind of gets shaken up in there a little bit. It's considered a non-invasive technique, right? It's a lot safer than, say, for instance, external versions. External versions is where you go into an obstetrician and they actually physically move your baby. Thank you so much. You are working for this book tonight, sis. Thank you for dropping that in the chat. Yes. So creating space relaxes the hips and baby can move around. Yes, this is, I couldn't have said it better. So that's exactly what you're doing. You're creating space for baby to be able to facilitate a better position. And this is so important. Again, babies we all go to the doctor, right? And I have had countless moms say, when I ask about the position, or if they talk about the position, the first thing they say is the baby's head down head down is only a third of the of the goal, right? It's head down is great, but we also, what position head down, right? We talked about the right and the left, but we talked about the right and the left. Babies can also be head down on the right, but more face up, right? They could be on the left, but more face up. So where their back is still more towards your back, that still can cause back labor. If your baby is here and kind of face up. As I mentioned, if you have, most of the time our babies hang out on the right or the left. And I said that at the top of the video, but if we want them to be facing your back. So if your baby is on the right, we need to be on the right facing the back. If it's on the left facing your back. Okay? And so there's terminology associated with that. I don't want to confuse anybody. Just keep it simple. On the right facing the back, or on the left facing the back is where you want your baby to be, or either just in the front. And as I mentioned, the reason why our babies a lot of times as Black women will not just sit in this position is because we have hips. We have a different pelvis, most of us do. And so our babies tend to hang out on the right or the left. They snuggle up in one of them hips. And a lot of times our hips hurt. By the third trimester, our hips are hurting from where that baby has been sitting all this time. So, be mindful of that. But so yeah, head down is only half of the mission. You want to make sure this baby is still facing your back, and then even the head itself, and this is not much that you can do, but the scarf technique and the hands and knees, and also cat-cow can really help alleviate what's called, and then lunges and things like that, side lying. Be mobile. Get them moving in this pregnancy, because babies can also be what's called asynclitic. And so that means their head is down, but it's kind of torted to the side. And so that can complicate a birth as well, right? So I don't want to overwhelm anybody with all of these terms and ideas, because, you get excited. Oh, my baby's head down. Yay. However, you want to be intentional about the position of this baby. Head down is great, but you can also help facilitate or optimize that head down position. And one of the best ways to do that is moving your body, getting on the floor, doing prenatal yoga, things like that. And then also seeing a chiropractor. Make sure your chiropractor is versed in Webster technique, right? Look up Webster technique so you know what you're doing. That's right. Sis, cat-cow pose. Exactly. Cat-cow pose is awesome. Also getting down there and lifting that leg. That side lying and lifting that leg up. All of this creates space. It helps baby maneuver their heads and help, because they want to come out too vaginally. That's how they were designed to get here. That's how they want to come out, right? And it's so many other biological processes that just work for both mom and baby when you can achieve a vaginal delivery. So I hope some of those things are helpful to you. Definitely do your research. Like I said, if you have a doula, that's great. She can help to even go in more deeper about the things that we just discussed, right? Head down, cardinal movements, sunny side up, all the things, right? Scarf technique. Boom. Okay, moving on. Yes, it is so amazing. You're right. How it all works together. So a couple of other things I want to highlight, right? We're talking about optimizing a vaginal delivery. I also want to help everyone identify progress of labor. What does that even mean? We hear this all the time, progress of labor. As a matter of fact, about a third of the C-sections in the United States are done or performed because of failure to progress. What do y'all even think that means? Progress of labor, right? So progress of labor is denoted in ideally about 3 things that we look at to determine progress of labor. And there's more, right? We look at contraction patterns and we look at some other things, but physiology, we're looking at 3 specific things. We're looking at effacement, or the thinning of the cervix. We're looking at dilation, which everybody talks about. Then we're looking at descent, or the head coming down, also known as station. Don't get caught up on the terms. I always suggest just understanding what it is, the physics of what we're talking about is more impactful than trying to know the terms, right? Because the last thing you want to do is be in a hospital trying to getting stuck on the term, and then you don't get the information that you need, the feedback, right? So, progress of labor. Let's first chat a little bit about the thinning of the cervix, okay? So your cervix ideally has to go from as thick as the cartilage of the tip of your nose. And let me say this because we tend to separate the cervix from the uterus, and we cannot. It is all one organ. I had a mom tell me, I think it was today or yesterday, she talked about having a procedure done to her cervix, and she felt like I wanted to show another little example that causes the cervix to relax, but then she had excessive bleeding postpartum, and so they never told her why. But my deductive reasoning is you can't relax the cervix without relaxing the whole uterus. It's all one organ. So if you inject something into the cervix, the entire uterus is going to be, the whole body is going to be affected, right? Let's start there. But definitely the entire uterus is going to be affected. And so the reason why I suggested she may have bled more profusely in that birth is because if they injected something to relax her cervix, then the uterus didn't have the strength or the will, based on the drugs they injected, to involute, to clamp down, is what we call in the postpartum, to stay firm and tight and keep her from bleeding. Because y'all, postpartum bleeding is different from menstrual bleeding, and it's very important that we understand that. Sadly, I didn't know the difference until after I had all my children and went to become a doula. I really associated postpartum bleeding with menstrual bleeding, and it was never explained to me. It may have been in the books, but it wasn't in the book I read. It didn't talk. It was on because I only targeted this one book that was the only book at that time. My eldest is 23, and it was the only book written by a Black woman. I could not tell you the name of it now, but that was the only book I read, and she didn't necessarily talk about postpartum bleeding and what it is. And so if you consider the placenta, once the placenta detaches itself and comes out of your body, you now have a wound inside of your womb that is the size of that placenta. Now wrap your mind around that, because these blood vessels and capillaries were attached to your blood supply. It's not like menstrual bleeding. It was directly attached to your blood supply. And this is where that bleeding is now coming from. When that placenta detaches itself and comes out of your body, now it's left behind all these open vessels. This is the bleeding. This is active bleeding. This is where hemorrhaging comes from. And so it is critical that your uterus stays firm, because in that firmness, it's applying pressure to that wound, right? That pressure minimizes the bleeding. Every time you breastfeed, it's going to cause your uterus to contract. All of that is a biological process to keep you from hemorrhaging. Okay, so like I mentioned, if they relax the cervix, then you've relaxed the uterus, and the uterus can't perform its duties. And what that particular hospital decided to do for her was just put her on a continuous drip of Pitocin to keep her from bleeding. I believe that's what she told me. But bringing it back into the cervix, I like to drop little gems when they come up, when I have the attention. Didn't intend to talk about all that, but there it is. So we're talking about effacement and the cervix thinning, right? So as I mentioned, the cervix has to go from as thick as the cartilage at the tip of your nose to as thin as the skin on your eyelid. And that's how we identify effacement or thinning of the cervix, okay? And so when we reach in, I want you to understand that a vaginal exam is an educated guess. It is not an exact science. And I also want you to take away from here, the cervix is a very intimate part of your body that you don't need to feel obligated to tell anyone how it's performing. Nobody needs to know that but you, and possibly your partner, and anyone you feel comfortable disclosing that information to. I mean, you really should be offended when people ask you, how dilated are you? It is none of their business. This is your cervix. It is inside, deep, buried in your body, that something we can't even see without a speculum. Okay? So don't feel like you need to tell anybody what your cervix is doing in labor. You don't need to tweet it. You don't need to IG it. You don't need to text it. It is a private thing between you, your care provider, and anyone else you want to divulge that information to. Okay? So the cervix, again, it is not an exact science, y'all. It's not. You're looking at, first of all, we can't even see what we're doing. We're feeling for it. We're going in, we're feeling for it. You find the tight rubber band, and then you guesstimate how far can I open my fingers within this tight rubber band. Now, I have little fingers. I'm a little person. If I do a vaginal exam, it's very likely that I'm going to come up with a different number than, say, for instance, a man whose hands is possibly twice the size of mine. I might say she's 3-4 centimeters. He might say she's 1. Right? And who's right? So ideally, what we're checking for every time we feel your cervix is, has the cervix changed from the last time I checked it? Does it feel any different this time than the last time? When you work in a hospital, you have to be as close to accurate as possible, because you got people, you have to chart that. And if you get off work, somebody coming behind you is relying on your numbers to be as close to accurate as possible. Okay, so just for your own clarity, it is not an exact science. And then there is something that we call the sphincter law, right? The sphincter law, every orifice on our bodies is protected by a sphincter. So when you touch the cervix, it is most likely going to contract. Instantly, it will shut down because it's designed to protect the baby. And so this is why when you do a vaginal, sometimes we'll hold our fingers there and say, and let's just wait for a contraction. And let's just see what happens with the contraction so that we can get a more accurate feel of where you are. Okay? So I digress. Bring it back into the thinning of the cervix, y'all. So we rate this, or we write this, or we measure is a better word. We measure our findings in terms of the thinning of the cervix in percentages. And you usually get a nice round fluffy number, right? So we do a vaginal exam and we feel the cervix feels, say for instance, we feel, and it feels as thick as your lip. We're going to say that's about 50%. If this is about as thick as your earlobe, that's about 80%. And then when it says, when you get to the point where you can't feel the thickness anymore, it's like incredibly thin. All you can kind of feel is this baby's head for the most part. We're at 100%. It's complete. You're rare. I don't think I have never heard it. I've never heard anybody say, oh, she's about 27% effaced. They might say 25. They're not going to be like, she's 33%. She's 62 4/4. You're not, it's not an accurate science. Okay. This is an educated guess at best. And so we are round bowl numbers. Is it as thick as the nose? Is it as thick as the lip? Is it as thick as the earlobe? Is it in between here? Okay, we might be 75. We might be about 60%, right? Is it eyelid? Is it in between the eyelid? We might be between the ear and the eyelid, maybe about 90%. I might even say 95. You're not going to hear 99. Okay, so that's the thinning of your cervix. And it is equally important as dilation. Dilation gets all the shine. Mamas tell me all the time, I just want to know how dilated I am. How dilated I am. Let me tell you, y'all. You can walk around a month at 4 centimeters. 5 centimeters. You can walk around a month, 4, 5, 6 centimeters and still be pregnant. Okay, thank you, Mama Saran, for my wheel. If you won't hear, right? Y'all make sure y'all follow her, birthing the tradition. So, you know, when we're looking at, we're feeling for how many fingers, how wide can we spread our fingers? So when we reach in, for me, I can't get a finger in if you're 1 centimeter, but I can get a finger in if you're 2 centimeters, right? I can get 2 fingers in when you're 3. Okay, if I can open them a little bit, and again, we're talking about my little bitty fingers. If I can open them a little bit, you're about 4 centimeters. You see how this goes? So on and so forth. Now, we don't keep going with hands to the point, we don't do this. The entire time, it's 2 fingers. And you're trying to guesstimate how wide you can spread those fingers inside of that cervix. Okay? And so remember, you're in there, you got to close them to come out. And then you got to remember how your fingers were on the inside. Again, we're talking about an educated guess. Now, factually, the more you do this, the better your technique, the more you'll be able to just feel and say, oh, you're about, 5-6 centimeters or whatnot. You can kind of get a feel for that before you even pull your fingers out. Okay. But if you're dealing with a student or a resident, when you go to the hospital, I was there, y'all. You trying to figure that thing out. You are trying to figure it out. It is an educated guess. It takes numerous cervical exams before you really master this thing. Okay. So this is the benefit of having your provider check you. Even when you're in the hospital, you may want to say, of course, all students, we got to learn. We have to learn. However, you and you know what you like. So you might want to just, depending on your personality and what your comfort level is, you may want to put on your birth plan, my vaginal exams only by my provider. And then the benefit to that is you're getting a sense of accuracy, or at least you're getting one type of, one set of hands. Okay, one set of hands. You're not going to mess around and get conflicting numbers. Okay, because I've seen women had to be checked like 3 times because the 2 providers got 2 different, you got a nurse and you may have a provider and they got different numbers and you got somebody else coming. So yeah, no, you don't want to deal with all that. You don't want to deal with that. You can limit it to one person checking you. Perfect. So dilation and effacement are equally important in birth, right? Dilation is not more. You can be, I'll say 9, so I haven't seen 10, but I've seen definitely 9, 8 or 9 centimeters. And we're still thick. The cervix is still thick. The cervix is possibly still, let's say for instance, it's still at the earlobe. We're still only 80%. So at that point, we can't push. You cannot push through a thick cervix because you could tear your cervix, right? And that's something we definitely don't want to happen. So that's one of the main reasons we check when you feel like you have to push, is to make sure that all of your cervix is out of the way so baby can come through and there's no risk to tearing your cervix. So effacement is equally important to dilation. Keep that in mind. The last thing that's going the number 3 for denoting progress in labor is station. We talked about effacement, dilation. Let's chat a little bit about station, and that brings us back to our pelvis, right? Because we measure station, or the head coming down, by these little bony regions here on the back of the pelvis. These little bony regions, they're called ischial spines. And so the goal here is for the person doing the exam is to try to decipher where is the head in relationship to those little bony regions. And remember, y'all, all of this is in centimeters. I have to bring it back there. We talking little tiny increments of movement, okay? Little tiny increments that we're recording and we're identifying as some kind of progress. We're not talking inches, yards, miles, or feet. We're talking centimeters, tiny, tiny centimeters. So we measure that based the head in relation to those spines, and how far is the head moving down beyond those spines. Okay. And so when the head is really high, now I will be perfectly transparent and honest, because I tell this to all my clients. Again, I have little fingers. And so for me, I don't necessarily try to figure out exactly where this head is. In relation to those spots. I've been trained to do it, but it's very uncomfortable, especially if that head is high. So if I reach in there and I feel a little spine and I don't feel the head, your baby's high. And that's what I'm saying. You got work to do. You got to get up, you got to squat, you got to move, you got to lunge. We got to get this head down, because I can barely just scrape the top of the head, So what we measure this in is negative to positive. So anything above these spines would be negative. -1, -2, -3, -4. And we tend to stop right around there. -4, maybe some books will go up to -5. That's 5 centimeters above this ischial spine. And then anything past that, we're measuring now in positive, right? So we would say +1, +2, +3. By +4, everybody in the room can see a little bit of hair, just to give you an idea of that little bit of movement and how significant it is, right? By the time we get to like +4 or so, we can all see a little bit of something peeking through the yoni, okay? So that's station, and I promise you, station equally important to dilation and effacement. All three of those things must align to denote progress of labor. They all must align for babies to come out. You can be 8-9 centimeters, you can be completely effaced, but if this head is still very high, and that happens. If this head is still high, or say for instance we're at a -1 or we're at 0, 0 would be when the head is right there at the spines, right? So if that's the case, you got work to do, mama. You got to get up. You got to move. You got to work this baby out. You got to work them hips. You got to move them hips. That's going to help. You got to squat and all the things to help make space for this head to move down and come through. Okay? So station, effacement, and dilation. So basically, station is the head coming down. Effacement is the thinning of the cervix, and dilation is the opening of the cervix, right? And all of these things help to facilitate a vaginal delivery. Let me stop clowning with y'all. It's been so good. I thank you as well for joining me and sharing your time in this space. You know, I value everyone's time. It is the most valuable asset I believe all of us have. Our time and our health, right? They're two greatest assets. So certainly value them. Thank you for sharing that time with me this evening. Remember to drink your water, get your sun, take your vitamins, and find joy in life. All right. That's all I got for you. I'll see y'all back here next week at 7 o'clock. Peace.